you have to show the device.
All right, Nisha the PA and Dr. Emer, we are live.
Hey guys, we're here doing the newest generation laser hair removal device. I feel very honored to be a part of this in 2014-15. The ASCLEPION company, you can see right here, came out with something called the MEDIOSTAR next. Now we're at the newest generation. This is the fastest and the best laser for laser hair removal right now. You go to a lot of these med spas that are doing laser hair removal, they're using older devices that take many treatments, just like I had to do at my arm, and even now you can see I still have a little bit left over because it's laser hair reduction. But these newer devices really get to the level of the hair follicle more quickly. Look how large the spot size is. Look how fast the treatment is. And in the past, the follicles used to get really inflamed. We called it perifollicular erythema or urticaria. Now you don't see that. The follicle is going all the way down to the follicle without causing surrounding inflammation. So he can literally go do anything he wants to do later today if he wanted to. It does still feel like little shocks, but it's so quick in delivery, although we are doing a higher setting for him because we want him to get a result. He's gonna see results more quickly within 3 treatments. Probably is still gonna need 4 to 6 treatments for the back. The back area tends to take a while, but he's gonna get a result more quickly. So Nisha, tell him a little bit about it.
So this is a new MEDIOSTAR, and guys, it's really great because like Dr. Emer said, it's a very fast treatment. Now, similar to what he said, you're not going to see a lot of that perifollicular erythema or edema, but what you will see in the next few weeks, his body is going to have a lot of shedding, which is going to be that hair follicle coming out and kind of being expunged. And then as he progresses, his hair is going to gradually get thinner and he's going to need less and less treatments. Now you are going to need several treatments. I would say anywhere between 3 to 6. It really just depends on how thick your hair follicle is, exactly the area we're treating, and really kind of your skin tone. But this is a great laser. We can use it on all skin tones. We just have to be really careful. But it's a pretty quick and easy treatment. So right now we're just doing the upper back and the shoulders. But if you want to do the whole body, come and see me. I'll be happy to get you ready for the summer.
All parts of the body. She will
all
do it
parts.
all.
I will do it all.
All right, so we do have a couple questions here. We have, is the person sleeping? No, our person is wide awake. We did not even numb. We have a thumbs are up, so that answers the person asking, does it hurt? His thumbs are up.
It hurts a little. Laser hair removal hurts no matter what you do. As you go to a more concentrated area like the neck or the genitals, it hurts more. Here it's pretty quick. He's a strong guy. You could tell, look at his biceps. He works out. So he works out. He knows what a hard workout's like. He could take, a couple little pokes from the hair removal. The thing I want them to hear is listen to this, though. I want you to listen. Okay,
so I'm doing some pre-cooling.
She's pre-cooling. You hear that? You hear those little snaps? That's the hair follicle. That's how strong the laser is without damaging the surface of the skin. The hair follicle is basically snapping because all the energy is going all the way down to the follicle. I like her technique. She's doing the circular technique of pre-cooling. That really helps there be much less pain. You hear that? That is like hair removal dream right there. Okay, that means we're getting treatment that's gonna work.
Okay, and yes, our patient did shave beforehand.
You have to shave before hair removal, you guys. And devices that don't use gel tend to have less efficacy because the energy from the laser can't transmit to the hair follicle as fast. So in this device, we're using a gel with the contact cooling, and that tends to be the best treatment. In 2007, Vic Narkar and I did some studies on suction devices, which was basically for 2-3 years the best treatments for hair removal. But now we have the ASCLEPION device.
Someone's asking, where are we located, guys? We are West Hollywood, California. There is our beautiful view right there. You can come see it.
Really just have to do one.
You can probably do 2 or 3.
Okay.
Actually, yeah.
Right now, Nisha is still treating a patient.
All right, so like I said, this one is it's a much more comfortable procedure compared to the other laser hair removals. And the big part of it is because you have all this gold part around it is cooling. So the more I kind of rub around this area and pre-cool the area, he's not going to so much feel the heat or a little bit more. It's going to be a little bit less of that rubber band snapping that he's going to feel. So I'm cooling all of that area down, and then I'm going back and I'm doing my treatment.
All right, Nisha, can we do this on a tattooed area?
So you want to avoid tattooed areas because remember, a lot of the times the way that these type of lasers work is that they're attracted to the pigment, and so tattoo is nothing but pigment. So you want to avoid tattoo areas. So if he had something like a tattoo on his upper back, I would actually go around that area and not treat it.
Did we use any lidocaine in this?
No, that's the great thing about it is that you don't have to numb. So you skip that 30-minute numbing session that you tend to need with other lasers, and you can literally get straight in and straight out. A little bit of gel.
How long does this treatment take?
I think we've been here for maybe like 5 minutes?
We've been here for 5 minutes, just hitting 6 right now, guys. So
I'm timing it, guys.
It's not a long treatment.
So I'm cooling the area, the whole area that I'm going to treat. It's really cold to the touch if you were to feel it. And then I'm going to go back in and I'm going to treat. Good. So I'm going to cool before and cool after. That takes away from some of the heat.
How many treatments do you need before you see results?
So it really will depend on the area that we're treating, but also how thick your skin or how thick your hair follicle is. So you have more of thicker hair follicles because maybe we're treating like the upper arm, the leg, then of course it's going to take you more treatments. If we're treating where you have, maybe you've had laser hair removal done before, so you don't really have a whole lot of hair, maybe the density is really low, then you're going to need anywhere between maybe 2 to 3 treatments, but he's going to need anywhere between 3 and 6 because his hair is a little bit more dense. So we're going to go back and do a second pass on his arms. I'll help him out and numb it. Cool it down before and after with a circular motion. And then I'll move to the next area, cool it, treat it, and then cool it again. And then cool it, and then move down a little bit.
What is that topical stuff on the skin?
So this is, I'll show you, ultrasound gel. That's it. It's nothing fancy. It's really just to help the machine glide, but it also works with a little bit with cooling as well. I'm going to get a little bit up here on your shoulders.
All right, and someone wants to know the cost of this. Nisha, what do they have to do for that?
So it's going to depend on the area, but in order to get the cost, I want you guys to reach out. First name, last name, email address. And then you can go ahead and reach out for a consultation so we can let you know the cost. It's really going to depend on the area that you're treating. So every area is different. How many treatments you need is different. But we'll be happy to walk you through that process. So moving on to the next area, cooling before and after.
Guys, thank you, Nisha.
All right, guys, I'll see you next time. Bye. I'm gonna get up